y'all. So I'm at my rabbitry right now, and I am wanting to talk to you about having a sick bun. I was searching through a lot of YouTube, as we all do, and Google searches, and could not find a lot of answers on what I was looking for, so I decided to take you on this journey with myself and my sick little baby and let you know what's going on. So this is day 5 of illness. Our mama had 9 kits. I have had her for about 2 weeks now. She was given to us by another rabbit breeder. She had an accidental litter in her cage, not separated fast enough with the male, and she gave birth. So her birthday is February 14th. She had her babies June 11th, and now it is July 3rd, and we're dealing with mastitis and now Snuffles. So it all started on Sunday when I noticed that her feces was not at the normal rate of just those little balls that you see. So she was having soft stool, it was getting stuck in the wire, and it was very large. It wasn't diarrhea, but it was very soft. So we took her out on Sunday. All she wanted to do was be loved on, petted, and I could tell something was wrong, especially with her teat area. It was swollen and inflamed. We went through Sunday. She wasn't eating. Monday I got in at our vet, which is very hard if you didn't know. A lot of places do not treat rabbits. They are considered an exotic breed, and it's very hard to find a place that will actually take you in, especially if she's not spayed. So we went in. We had an appointment at 3 o'clock on Monday. She had not eaten since Sunday morning, and so I was new to this. I'd never had a sick bunny, so I didn't really know what to do. Monday, when we went into the vet, she was 6.1 pounds. Not feeling good. Obviously had purple swollen mastitis. I'll show you what it looks like in a little bit. And they gave us a antibiotic shot that I was to administer twice a day. It was called cefazolin. So she got it on Monday evening, 2 doses on Tuesday, and 1 dose Wednesday morning. Yesterday, Wednesday morning, the vet called me and asked how she's doing. I said she still hasn't been eating. We have been feeding her, syringe feeding her, and really not much improvements. In fact, she has had a lot more nasal discharge, which is often considered Snuffles. If you didn't know, rabbits already have Snuffles in their immune system. However, when they're under stress or an illness, it can bring that out. So now we're fighting Snuffles and mastitis. So we went to the emergency vet last night because she was still not doing well, and our vet could not get us in yesterday. So that was probably like the worst experience of my life. We sat in the waiting room for 2 hours. They took her back. I hate when they take the animals back without you. I did not see her for 2 hours. Finally, they came in and they said they were going to keep her overnight, do surgery on her in the morning, and it was going to be almost, I think, $2,500. And that was not okay with me. She is a meat rabbit, but my philosophy is to do all that I can before culling her. Now, some people would just have culled her immediately, but I would like to try and see what we can do. Also have this as kind of an educational learning for other people that are dealing with a severe case of mastitis and how to treat Snuffles, because that was really something that I couldn't find on the internet. So hopefully this is learning for everybody, and she might, we'll see, she may make it, she may not. She probably won't be in our breeding group, and if I do tend to breed her, we're going to wait a long time until she's completely recovered, and then make a decision at that point. So I have been feeding her through a syringe. We have been doing a mixture of critical care. She has also been getting some I bought the milk replacement for the babies, and so I decided that has calories in it as well, and we've been giving her the milk replacement for the liquid to do in the critical care, as well as she has gotten Pedialyte unflavored version, and she has gotten the gas drops for infants. So we've been doing that since I would say Tuesday would be when we started the feeding with the syringe. Monday night was the first feeding, but we didn't do gas drops until Tuesday. And then she has been getting critical care as well as the Pedialyte. Now she is drinking water, she just still has not touched her pellets. That is something that I really would like her to start doing, and I'll keep pushing the critical care on her until she does begin touching the pellets. That would just be something nice to see. Now we haven't had a lot of bowel movement action until today. Today is the first time we've had actual bowel movements. Now they're not the normal size yet, but they're coming out, so that's good. Probably in the past Monday, Tuesday, Wednesday, maybe 10, and we have more now. So I'm going to show you her. We're going to take her out. We're going to go through a feeding cycle, and I'm going to talk about what we use. I'm also going to post the links to Amazon for you to purchase it. I am an Amazon affiliate, so if you purchase it through my site, I do get a small commission, but I really am just here to try to help people out. So let's go meet Thunder Bunny. Okay, here is Thunder. She's currently in her cage. Like I said, she has had some normal poop. If you can tell down here, you can't really tell because she dumped her junk food, her manna seeds, sunflower seeds, and whole oats, but we do have some poop. That is way more than we have had previously, like way more. Thunder Bunny is in here. She's in her house right now. She does have the sniffles. I'll get her out and we will look at her up close. She is separated from her babies right now because of the severity of the mastitis. We had her in until Tuesday night. Tuesday night when I took her out after they had nursed, she was just completely bloody, and it wasn't a great sight. So I made the choice to just stop with the nursing, and just for her and her sake, and they seem to be doing fine. Like I said, they were born June 11th. They're eating hay. They have Timothy hay in here right now, and also compressed alfalfa, and they're eating pellets. Most of the time they dump their pellets on the ground, but they are trying to eat their pellets, which is great. We have not lost anybody yet, so I'm hoping that they'll be okay without her milk. Okay, y'all, so here's Thunder, and we're going to go through how we have been feeding her. You can hear that her breathing is not normal. Normally, probably Snuffles. She has some discharge under her nose that we'll wipe off with a warm cloth. She actually has been making improvements. Sunday, Monday, Tuesday, she wasn't moving around. She wasn't curious about anything. However, her breathing has become a lot more labored, but when we all have runny noses, that happens to us too. So what we're going to do is, this is a critical care mixture that I made. I followed the directions on the bag for this. It is right here. I will link that on my comments below. In the description. You want to get the critical care for the herbivore. So now if you were going to do this for more than a few days, it actually uses more than you think it would. So this is almost 5 ounces of critical care, and they say that they want you to use 3 tablespoons of the product per kilogram of body weight. So a kilogram is about 1.5 to 2 pounds. So she should be having, if she's 6 pounds, 9 tablespoons of this a day. We've not been getting that much into her, but if we were getting 9 tablespoons, this would not last us very long. I mix it with this, which is Mana Pro Nurse All, and this is what you can give your baby rabbits when mommy stops nursing. This is what I bought it for, was for the babies. It didn't work out too well to try to feed them from this, so I've been using it to make her critical care because she really loves it. And it's just more protein, more calories, more that I can get into her. Now, instead of using water to make the critical care and the Nursol, I've been using Pedialyte, unflavored Pedialyte. Gives her more electrolytes and more hydration. So try to get as much water into her, as much liquid, as much calories as you can. I mentioned that we went to the emergency vet yesterday, but I didn't tell you what medications. So this is a painkiller. The painkiller they gave us is called Metacam, and she gets this once every 24 hours, and there is 5 doses in here. Another thing they gave us is this liquid medication. She gets twice a day. Trimethoprim-Sulfa. So this is treating the Snuffles as well as an antibiotic to help with the Mastitis. She'll get that this evening. This is our afternoon feeding. And then I also give her, every time I feed, gas relief drops. This is the infant. She receives 0.3 milliliters. So on here, it is the first spot down there. She absolutely loves this stuff. I don't know if it tastes sweet or flavored, but she absolutely loves this stuff. And this is helping with the GI stasis. Another thing I've been doing is this liniment. And this is a liniment gel that I have been putting on her mammary glands and helping with the mastitis. It's a cooling, calming. It seems to be helping with the swelling, but like I said, she's has a very severe case of mastitis, so sure she's in a lot of pain from that, but this is helping an awful lot. And that's really all we have. So I'm going to put those links below for where you can purchase that on Amazon. And we're going to go about feeding her. I will show you her mastitis. That's how this all started. Just one teat was really purple and inflamed, and it happened overnight. And then it's just gotten increasingly worse from there. So let me see if she'll let me show you that, and then we'll go on with her feeding. Come on, Mama. Okay, so I shaved around her areas here. This is the teat that is purple and inflamed. It's really not that pretty to look at, and I'm sure she's in a lot of pain, but we've been trying to help her with that. One of the things I did use was this to shave her. This is something I use on my dogs, but this actually worked out really well for her as well, and I had it on hand already. So this is just a battery charger shaver. It's not too loud, but I switched it out to the smaller attachment here, put it on, and it's really nice because you can adjust the frequency, and it doesn't hurt. So I can touch this and I'm not getting cut. So this is really good for cutting that matted fur that was down around her teats, which was probably helping to not fix the infection. So we wanted to clear that up because that was, I think, causing more infection than was really worth it, and I could really see what was going on with that. So let's get into her feeding. You want to do this on a surface where you can make a mess, because I try to do this as best as possible, but she still gets kind of messy around it. So we're going to pull this up. This is a little thick. It's been sitting in the refrigerator for a while. I warmed it up at 30 seconds, but she does not like it at this consistency. She likes it a lot smoother, so I just put in some of this to make it more liquidy. And again, that's the Nursol milk replacer from ManaPro. Make sure to stir it up really well. And she's gonna gobble this up. Now, until now, I have never syringe fed a rabbit. It's actually kind of difficult. So where their nose is, that's not where their mouth is. Their mouth is way down on the bottom. And you have to, yeah, are you hungry, Mama? You have to kind of lift their head up, and then they'll open up. And she's really good about her feedings. I think she's hungry, but I really would like for her to have some pellets. So let's see if you'll be able to see this. I'm gonna kind of put her in between myself so she can't get away. Lift her head, find that cute little spot, put it on the side, and then give her a little bit at a time. Good job, Mama. Now, you can tell when she needs a little break, and because her breathing is so hard, she needs to have a little bit more time to swallow and kind of chew that up. But I'm going to try to get 4 of these in her in this feeding, and then possibly 1 or 2 of just the milk. Now you're going to get messy, and it's not the most wonderful thing to look at. It kind of looks like nastiness on your hand, but it's worth it if you're helping your bun. Give her some time. This is a 2 teaspoon syringe. This is not the syringe I would suggest because it's so little of a area here that a lot of times it gets stuck because the critical care is more dense. Let's give you a little break, Mama. So I'll post one that I think would be better for syringe feeding. I'm gonna give her a little wipe on her chin. That's my dog Tank. He just absolutely loves our buns and is very, very worried. I'm also gonna wipe off her nose a little bit, help her breathe. She doesn't really like the nose, as most rabbits don't. Another thing that we have been doing for her is this water vapor. She loves it. So I just put her head in here for a little bit. She breathes in that warm vapor. It's kind of been helping clear that nasal passage. And we do it on and off as we are feeding. As you can hear, her little sniffles. Makes me so sad. But we're trying to do what we can for her. A lot of people would probably have culled her already, but like I said, I want this to be kind of an educational post because a lot of us, you know, we love our bunnies like they're our family. So I'm going to go on feeding her. I'm going to fast forward through this so that you don't have to sit here through this whole process. It takes me about 45 minutes. Okay, now that we have finished feeding her, it's time to treat her mastitis. So I laid with her with a warm compress across her belly and kind of massaged a little bit as much as she would tolerate. The little concerning part is that it is bleeding and a little bit of oozing. The teat that is most infected has this kind of hard scab on it. So what I saw on some YouTubes is that it will just kind of shrink up and kind of fall off like a mass. I don't know if that's what's going to happen with her, but it doesn't seem like it's very, very pleasant for her. So now I'm going to put on the liniment oil. This is a soothing, cooling, used on horses for swelling and sore muscles, but it can really help with swelling. I've noticed that it's brought it down quite a bit. The dark area is just going to be dark unless we decided to get her surgery. We're trying to see if we can not go that route because she's a meat rabbit and it's just not cost effective. But I'll see if these little home remedies will be helpful. So I'm going to put this across her chest and then she's going to go back into her crate until our evening feeding. This is where I'm most concerned. It's really not pleasant, so we'll see if that improves in the next day or so, and then we'll have to make a decision. Day 5, afternoon feeding. Miss Thunder Bunny.